Good evening, guys. Welcome to our video today again. It's a good evening here in Africa. Most of the time I do these videos in the evening, and today is one of the evenings I'm going to do our video. So I hope you'll enjoy our video today. Let me know what you want us to share in this channel. Thank you for the great comments we have had in our comments section there. The channel is Future Talks, and today we are having our discussion. You're seeing me with the stethoscope and also in this attire. So today it means matters medical. Especially we're going to talk about a class of special drugs which we use or people use. Maybe you may not be using them, but somebody somewhere may be using them. Maybe your relative, maybe someone else you know. And these are special drugs called calcium blockers. So calcium blockers are very important drugs which are very important to us. So they really help us in various sections, as we're going to see in our presentation today. So from the definition of the drugs, these are actually drugs which block calcium in very many areas in our body, as we're going to see shortly. So type 1, they work on the vascular smooth muscles, that is the coronary and also the peripheral arteries. The vascular smooth tissue, muscles, they block they block the calcium in those muscles to affect how the vascular smooth muscles work, especially the coronary arteries. And the coronary arteries are special arteries which work in the heart. They supply the heart with oxygen and also with other nutrients which the heart needs to function. So these drugs, special kind of drugs called calcium blockers, they block the way these calcium blockers work. Also, they also affect the cardiac myocytes. These are special cells which make the heart. From our previous video, I shared on how our heart functions. Our heart functions from the time we are born from the time we are born up to the time we die. Actually, during the time also of the child or the baby growing in the womb of a mother, when the heart is formed, that is when those muscles are formed, and they work till someone dies. So if you live up to 120 years, it means that the heart should be pumping for all that time, because also we have what you call fetal heart rate. That before a fetus is born, we have some special way we find out how the heart beats. So the special myocardial myocytes, these are special cells which form the heart. So with the calcium blockers, they also affect the contraction and also the relaxation of the heart muscles, and this really affects on how that one functions. Also, with the calcium blockers, they also affect the way the cardiac nodal tissue works. We have a special conduction of the heart called sinoatrial and also AV node, which affects the way there's a way heart works like an electricity. So the AV, the SA and AV, they are really affected with these kind of drugs. So they also affect vasodilation, that is the opening and the closing of the blood vessels. So with that, with the opening and also decreasing of the size of the heart, so they affect normally, because of they relax the vessel so much, they cause what we call vasodilation, and vasodilation also causes the kind of reduced blood pressure. So also with the relaxation of the coronary arteries, so there is a way the pumping action and also the flow of the blood is really affected in the heart. So this kind of functioning of the calcium blockers affects on how our body works especially the hearts. That's the calcium blockers. They really affect how the functioning and also the relaxation of the heart. So that's why we have a special consideration when giving those drugs or when administering those drugs to our patients, so that we be very careful on how we administer to them, and also monitor for special things as I'm going to mention shortly. The things which you look at as a patient on the patient, which are very vital, and also the things which you teach your patient as you start that kind of the calcium blockers uh, on those kind of patients. Guys, welcome to our channel. Kindly, if you have not subscribed, Future Talks, kindly subscribe and also give us a nice comment down there, like the video, and also share widely. For those who have been watching our channel and you have not subscribed, kindly subscribe, because we have a lot of us who are watching the channel and we have not subscribed. I appreciate you watching the channel, but also by subscribing, that's the best way you can also support this channel. So guys, welcome on these calcium blockers, drugs, which are special class of drugs which affect on how our heart. Normally we have two kinds of these drugs. We have the ones which we call dihydropyridines. We also called vascular selective uh, dihydropyrinates. I'm going to attach the name here. You're going to see it. It's also called vascular selective. And the example of these kind of drugs is amlodipine, felodipine, and also nifedipine. They are mainly used for hypertension and also for angina. Uh, and also we have the second class called non-hydropyridines. So these are non-vascular selective. You can simply call them the non-vascular selective. So they are myocardium selective. That means they work on especially the myocardium. Myocardium are special muscles which form the heart, or they work on the heart. So an example of this is ferrobamil, and also we have the one called ditazene, so which also work on the myocardium of the heart. So those are the two main special kind of drugs which work we have vascular selective, which work on that vascular means on uh, the vascular system, that is on the arteries, and also the circulatory system of the same. And also we have myocardium selective, which work on the myocardium. I've said about vascular selective. An example is like amlodipine, velopin, velodipine, and also nifedipine. And an example of an example of dihydropyridines is, or myocardium selective, is verapamil and also the diazepam. So these two kinds of drugs, they work differently, and also they affect the way the heart functions or the body functions in a very special way, as we're going to see. Guys, thank you for watching, and also welcome to our channel. We are talking matters about the channel blockers kind of drugs which we use, or they are used. So as an healthcare worker, there are things which you should monitor, especially as a nurse and also as a physician or as a doctor on your patient who you've started on the channel with the channel blockers. So the first thing we should do is to monitor the blood cardia and also the hypotension, because the way we have the drugs, they affect the way calcium is absorbed and also the functioning of the vascular and also the myocardial function. So you check for low blood pressures and also teach your patient over the same about to to always monitor the pressures to determine if the pressures are really coming down. Another very important thing which you should also monitor is also about what we call orthostatic hypertension. That means hypotension. That means orthostatic hypertension means you should teach your patients when they, especially if they were seated and they want to stand, because of the sudden change of the pressures in the body, the patient may fall or something may happen. So the patient should be told to do that one slowly, because the channel blockers are likely to get the pressures very low, and the patient is likely to fall when the patient stands. So normally this one can be caused by what you call reflex tachycardia, sudden change of that pressures, because of the channel way of is affecting the way the body is functioning. So that is very important. Also, the patient should be exposed to EKG or echocardiogram to check how the AV node. We saw that the AV and also the conduction, the heart conduction, or the conduction part of the heart, because there is a part of the heart which works like electricity to make the heart always pump. So the AV and also the sinonatural node is affected on how the conduction of the heart is done. So EKG can really show if the patient is having a block, what you call a block. So that is actually finding out there's a normal wave on there's a normal wave where you find a normal wave of the heart and how it functions. So it's very important to do the EKG or the echocardiogram for that kind of ECG for such kind of patients, to determine if the patient are moving from the first AV block to other problems. Also, very importantly, the patient should be checked for heart failure, signs of heart failure. From our previous video, we shared on what heart failure means. So it's very important to always find out if the patient is getting into heart failure. And if a patient from our previous video, as I shared, patient may present with the bronchodilations, and also that means the lung is affected. So dyspnea may be there because of high volumes of fluid which is accumulating in the body. The patient may present with gaining a lot of weight after starting such kind of medication. Patient may be presenting with edema on the limbs and also on some parts of the body. So those could be the signs of heart failure, which can guide you to change to other things. So the patient should be also advised not to take grapefruit juice, because it's likely to bring problems with the patient. So these patients on the channel, especially the calcium channel blockers or CCB, they are the calcium channel blockers. They are advised not to take a lot of not to be on the grapefruit juice, because it may bring other problems in the body. And also the patients, because of developing other problems, they are advised to be on high diet of fiber, because also the so as patients are being advised on avoiding grape juice in their diet, they're also advised on taking on taking uh, on taking a lot of consideration, especially on the oral hygiene, so which is very important for them, so that because the drugs are likely to corrode especially and cause dental caries in the mouth. So teach your patients on how to brush after taking the medication, and also take care of their so that we take care of their dental problems. And also food in in, uh, in their fiber. Foods should be high in fiber. That's example of, like, they check things like cassava. Those foods we know they are high in fiber is also for a very healthy for them, so that they don't develop also other problems like constipation, because the drugs are likely to cause things like constipation in them, so that we counter such kind of problems from them. So those are the consideration you give as an healthy worker So monitor your patients for body gain, so that you also monitor for other side effects like heart failure. Also monitor the blood pressures for signs of hypertension, guys, and things like sudden weight gain and also edema of the extremities. Very important that those patients get monitored for the same. And normally when the patients have a lot of problems, the calcium blockers that are changing to another class of drugs, because there are a lot of other classes of drugs depending on the problem of the patient. But normally these are kind of class of drugs, they are very important, and also, sorry for that, they get to manage the patient very well. And most of the patients who are on these drugs, they do very well on it, because the drugs are they work, the onset is very, start working in a very fast way, so that they help the patient with the problem like in hypertension, angina problems, and other problems. Guys, welcome to our channel, and also I want to welcome you to our next video. Kindly, if you have not subscribed, subscribe, and also share with your friends. And also we want to take the channel to another level. Let me know how the channel is doing, what you are finding out, and how you want us to improve the channel, so that we will give you the best. Like I always tell you, this channel is for you, and also Future Talks is for everyone. We want to make it the best. When the road to 10,000 subscribers, kindly give us a like, give us a comment down there, so that we take the channel to the next video. Peace, guys, and thank you very much.